everyone, my name is Ugweze Kwindale Chamaka, a third level student of pharmacy, University of Nigeria. There is this misconception that the youth have these days about hypertension. They normally think that hypertension is only a disease for the elderly. But there's something about hypertension I want to tell you about. Hypertension is not just the disease for the elderly persons. Hypertension can happen to you as a youth. So don't think that hypertension is just a disease for the elderly persons, because it can happen to any of us. Now let me tell you things about hypertension that you don't know. Hypertension can be as a result of another sickness, not just hypertension. There are some diseases that when you get them, when you are sick, it tends to increase your blood pressure. These sicknesses tend to increase the hypertension, but in such case scenario, you are not suffering from hypertension. So the only best way to treat hypertension at that point in time is to treat the disease that is causing the hypertension. That doesn't mean that hypertensive drugs can't be prescribed. They can also be prescribed in that kind of scenario. The things that causes or might cause hypertension: we have disease, we have substance or food intake. This kind of hypertension can be managed if detected early. If it is an hypertension caused by food or substance intake, once you stop taking that substance and you treat the hypertension at that early stage, you will cure it. But if not, once it reaches the end stage, which is the late stage of hypertension, you cannot treat it. Now, mind you, hypertension is a disease that cannot be treated but managed. So you need to start now and manage your blood pressure. You need to go and check your blood pressure regularly. It doesn't cost you much, it doesn't cost you so much. So try as much as possible to check and know that your blood pressure is in peace. Once you've been marked as a hypertensive patient, you cannot treat it. All you have to do is you have to manage it. And how do you manage it? You keep on taking your hypertensive drug every single day, irrespective of the fact that it has come down to normal. Reason being that you are different from a normal person, and any small thing can trigger the blood pressure to go high, and there's some stages it can reach. You might end up fainting, collapsing, or even dying. So it is very much better that once you are being marked as a hypertensive patient, you must take your drug regularly. Don't say my hypertension has cured, or I used to be a hypertensive patient. There is no such word as that. And what are the risk factors of not treating your hypertension? This might result to stroke, and it can also result to cardiac arrest, which might end up leading to you slumbering and dying, sudden death. It can also result to severe headache. Yes, hypertension gives you severe headache, the kind of headache that is different from the normal headache you know, and it can also give you sleepless nights. So in order to prevent these risk factors, it is better to be safe than to be sorry. And also, low BP is not the best. It is also dangerous, just like hypertension. So it is very much advisable that you as a youth, you should start now and take care of your health. You should start now and check your blood pressure and make sure that your vital signs are in